Hello everybody. I'm talking today about the topic of alignment of the pelvis and the spine. When things go wrong, when the pelvis is higher on one side than the other, or the spine ends up with curves that put more stress on your body. It's a problem that is very common. It affects about 80% or more of the population. And it's something that if you can recognize it yourself, learn to recognize what it looks like, you can also learn to either help yourself correct the alignment when you're out of alignment, or to seek proper help from people that are trained in dealing with this type of problem. There are a number of changes that happen when the pelvis goes out of alignment. It makes differences to the way you walk. You end up with a shift in the way your feet bear weight. One foot tends to collapse inward and the other one outward. There are differences in strength. Some muscles on one side are weaker than their partner on the other side. There are also differences in leg length. The overall effect is that it decreases how well you can perform certain sports, for example. It may limit how far you can go in a sport like figure skating or ballet dancing, because of all these limitations put on you by the pelvis and spine being out of alignment. This may sound like a lot of doom and gloom, but the solutions to the problems are, first of all, recognition, recognizing that you've got a problem with your alignment, and you can easily learn. And also there are ways that a lot of you can put yourself back in alignment. So it's very important, because this way you can help yourself on a day-to-day basis. Maybe getting supervised progressive exercise and fine-tuning with a physiotherapist or chiropractor or osteopath, someone who's trained in dealing with this type of problem. And it makes a lot of difference if you can do this on a day-to-day basis. And it could be anywhere. It could be on the soccer field. It could be in your office. As soon as you recognize, hey, my pelvis gone out of alignment again, check it out. I'm out of alignment this way. That's what I do to correct it. One question is, how do you go out of alignment? Now, a lot of times people go out of alignment and they have a history of having had an accident, a fall, or they may have gone through a delivery, delivered a baby, which is quite strenuous and puts a lot of stress on the pelvis. They may have been in a car accident. But actually, in most people, there's no obvious cause why the pelvis goes out of alignment. One of the key points is that in 95% of people, the pelvis goes out in 3 specific ways that you can learn to recognize and to correct on your own or with somebody's help, after you've had instruction in how to do this, to recognize it and treat it. When we walk, there is movement of the pelvis. The hip bone on each side moves forward and backward with the legs, moving forward and backward. The whole pelvis as a unit, the whole ring of bones, moves forward with the leg that's swinging forward, while the other side goes back, and then reverse as the other leg swings forward. And the whole pelvis, again, also goes up on one side, down on the other, and as you continue walking, it goes up on the opposite side and repeats. So there's a cycle of rotation of the hip bones, going up and down, and also going forward and backward. And for some reason, the pelvis can get stuck either up on one side, down on the other, or with one hip bone having rotated forward, the other one backward. And the third way of the pelvis having rotated forward on one side and getting stuck in that position. All this can be corrected either using your own muscles to pull the bones back into their proper position, or in the case of what we call an upslip, where one side of the pelvis ends up higher because the leg has been driven upward on one side. That can be corrected using simple traction on the leg. And the third way is using leverage, where you actually use your leg, the bone, like your thigh bone, as a lever to put the pelvic bone back into its proper place. It's a simple concept. You can detect being out of alignment, and you can learn to correct it yourself.